Well, good evening once again to the friends and family of the brothers of the mighty second district of Omega Psi Phi Fraternity Incorporated. My name is Kelvin Ampofo, and I have the pleasure of serving as the 37th second district representative. The second district, we're comprised of the states of New York, New Jersey, Pennsylvania, Delaware, and Maryland. And so certainly on behalf of the brothers of the second district, we certainly thank you for joining us as we've been here continuously making sure that the community is up to date as it relates to COVID-19. Certainly also want to acknowledge our leader, our Grand Bossless, who allows us to do the work of this great fraternity. So to Dr. David E. Marion, our 41st Grand Bossless, we certainly thank you for your leadership. Let's get started. We have a lot of new people that are joining us. And so I want to quickly introduce our distinguished, esteemed panel known to the members of Omega Psi Phi Fraternity as our four horsemen. We're going to start off, we call him 78. This is Dr. Keith Boykin. Dr. Boykin is a retired pediatrician who constantly makes sure that we have the most up-to-date information as it relates to stats with a special interest as it relates to our young people. So Dr. Boykin, it's always a pleasure. So good to see you. We also have Dr. Jedan Phillips. He's a physician from Stony Brook Family Medical Group in New York City. As we all know, New York was the epicenter of COVID-19 when it all began. So we certainly look forward to the information that Dr. Phillips shares with us. Dr. Phillips, good evening to you. But joining us a little later is our other horseman, Brother Wonzie Gardner, federal government employee. Certainly is going to give us some information as it relates to the government. And Dr. Cedric Guyton, a pharmacist, 25 years. Certainly, we look forward to them joining us so we can move forward. Additionally, we have some special guests, some returning doctors that just mesmerized everyone. Last month they were here, and so some of them are joining us. Dr. Kathy Hardwick, certainly certified by the American Nurses Credentialing Center as a family nurse practitioner. And certainly she represents the ladies of Alpha Kappa Alpha. So Dr. Hardwick, is so good to see you. We also have with us Dr. Yolanda Lewis Ragland, is a double board certified physician in both pediatrics and obesity medicine. She's the owner and CEO of Family Fitness and Wellness for Community Health and founder and president of Dr. Yolanda Cares Foundation. And certainly she represents the dynamic, devastating divas of Delta Sigma Theta Sorority Incorporated. It's so good to have you. And last and certainly not least, oh, we have a treat for everybody. Dr. Certainly, Dr. Lewis, we thank you for joining us. It's a pleasure to have you. And so with that, we're going to get started. Dr. Boykin, as always, we're going to start with you, my good brother. Please start us off with the latest and greatest. What would you like to share with us at this point, Dr. Boykin? We got you
Uh,
on mute, Dr. Boykin. There you go.
okay. Good evening, everyone, and welcome to our monthly webinar. It's certainly a pleasure to be here representing the second district in our fraternity tonight. We have a lot of wonderful guests, as we said. I certainly would be my typical way of starting off with some statistics, but I'm going to change it just a tad bit different tonight because I think everyone talks so much about community transmission. And right now, the United States is no longer a totally red, high-risk community transmission rate. We have about 10 states now that are moderate. We haven't got down to low, but we know we're getting there. But on the same thing, I want to remind folks that, cases have been trending downward, but in the last couple of days, they're starting to trend back upward. So that's a little bit of a concern there. On Monday, new deaths in the United States were about 178, and new deaths as of yesterday were 1,098. So we're getting up there. Vaccinations remain at about 66.5%, and peace is still at about 16.5% of cases and 25% of cases over the last 2 weeks, which is up about 4% in terms of pediatric cases. And only about, if you talk about vaccination, only about 12.9% of African Americans are fully vaccinated. And that's a little bit concerning because that's where we're having the most vulnerability in our own communities of color. If you take that in contrast with the number of white people that are vaccinated, fully vaccinated, they're vaccinated at 61.2%. So that's a huge contrast between communities of color and those. And the other thing is that females far outweigh males in terms of when it comes to being vaccinated. Now, you probably heard on the news that Delta is going away, but that's not really all that true. It might have slacked off somewhat. I mean, it's only like 99.5% circulating of the original Delta variant, and 0.1% of the subtype, which is now 99.6% circulating variants out there, which comes down from 99.9%. But the worrisome part about that, there's 0.4% of unclassified or unnamed variants out there, which is up about 0.3%. If we look at the distribution of the variants, the Northeast, the Southeast, and the Northwest of our country has the highest concentration. So we need to think about that. We think about vaccines. A lot of new things have happened since we last met. Boosters was a big thing in the news recently. You probably all heard that the FDA and CDC have fully approved the use of Mrna and Johnson & Johnson as either a booster or, in the case of Johnson & Johnson, a second dose for that vaccine. And just yesterday, the FDA has recommended and referred to the CDC that Pfizer's 5 to 11-year-old vaccine be approved for usage in that age group. So I would bet that by next week this time, we'll be seeing pediatric people being vaccinated in that particular age group. We're going to talk about that a little bit later on tonight, because we're going to talk about the youth mix and the youth portion of our vaccinations. The other thing we want to talk about mix and matching a little bit. It's not really that big of a deal, but there are some cases where it might be beneficial in terms of Johnson & Johnson. We also want to think about what are parents thinking about this? Where are we with the vaccination and parents? And we know that parents look up to myself and Dr. Ragland as pediatrician, and Dr. Phillips as well, for what our recommendations are and what we think about that. So I will tell you up front that I am fully recommending the Pfizer vaccine once it becomes available, particularly for my own family. I'm going to be recommending that. And then the last thing we need to think about is the upcoming holiday travel season. And that's kind of worse than that, because we haven't even gotten to November yet. And as I said at the beginning of this, we're already seeing an uptick in cases and deaths. And the sad thing about it is that the victims of this pandemic right now are our children. I mean, just this past week, we had a family, a mother and father who refused to get vaccinated, even though their parents were vaccinated. Both died in the ICU of COVID-19, leaving 4 young children. And just before I got on the phone tonight, I had one of my fraternity brothers tell me about another one of our brothers who was believing that conspiracy theories and refused to get vaccinated, and died a very horrible death over the last 2 months from COVID-19, leaving very young children. So I say to you, we need to really take this thing seriously. This is not a hoax. This is real. Statistics are there, but the sad thing about it as well is that probably not all pediatric cases are reported. So they're underreported and they're underrepresented because, lots of times when a child shows up somewhere ill, there's just a virus to go home, and maybe not even be testing some of the outlying things, because inner city is probably more in tune to what's going on, but it's the rural areas that are now having the biggest concentration of unvaccinated and cases. Because those are cases out there where, what's their source of information? Well, I talked to Johnny last week. He said, don't get that vaccine. So that's not the right way to do it. So with that, Brother DR, I'm going to yield, because we have a lot of things we need to talk about tonight. So I'm going to yield back at this time.
Well, Dr. Boykin, as always, thank you so much. And certainly, let me just remind those of you that are joining us for the first time, you're going to hear a lot of information. And I just want everybody to be mindful that comments and views expressed by individuals tonight are their own. Okay? Does not necessarily represent the views of the Omega Psi Phi Fraternity or the entities that our guests may be affiliated with. All right. So with that being said, Dr. Phillips.
Good evening. Good evening. And again, I think it's great that we're here tonight. I think it's an important time because, again, as I've been saying over the past year, all we got to do is look abroad to get an idea of what may be happening. And one of the concerning things right now is that we're seeing the number of cases in the United Kingdom start to increase. And the increase in those cases, in a lot part, is due to the unvaccinated, the kids going back to school. it's due to the controversy involving masking. So again, the reason why tonight is so critical is, unfortunately, this is the same time last year where we started to see the cases start to creep up and get to that peak where we were over almost 4,000 deaths a day back in January of 2021. So again, us having this conversation tonight with all of these new pieces of information, I think are very critical. As far as my practice as a family doctor, you know, I have been seeing that the number of cases in our hospital with respect to COVID in comparison to about a month ago have decreased. Unfortunately, still seeing the trend of those being hospitalized, those that are having more serious situations, most of them tend to still be unvaccinated. In addition to that, I'm now starting to see a lot more issues related to the indirect impact of COVID. Hey, Dr. Phillips, I'd like you to sign or write a letter of medical exemption for me. Dr. Phillips, do you think I need a third shot? Dr. Phillips, do you think I need a booster shot? Dr. Phillips, what do you think about my children under the age of 12 getting the vaccination? So as Dr. Boykin just said, you know, my week has predominantly been asking or answering a lot of questions with respect to what will be happening in the upcoming week to 2 weeks. So with that, I know we've got a lot of stuff that we want to cover, and I want to hear what the ladies have to say as well. So I'm going to yield my time. Thank you.
Thank you, Dr. Phillips, and we're going to do just that. So let's start off with Dr. Hardwick. Here we are. The talk of the town right now is boosters. Any information you want to share with us as it relates to boosters? And don't forget, the ladies is here. They waiting to hear from y'all. So represent for the ladies. Now you saying all that good stuff, Dr. Hardwick, and we can't hear you. What was oh, okay, we gonna, you know how we do. Dr. Ragland, go ahead, look out for your sister. She gonna get that fixed. Go ahead, Dr. Ragland, represent
All
for
right.
the ladies.
All right. Well, I know that Dr. Hardwick was busy telling us that boosters are available, but let's be clear that there's a difference between boosters and a third dose. So right now we are recommending boosters be administered to particular populations, be they those that are over 65 years of age or those who have some underlying medical conditions, maybe cardiovascular disease. I would venture to say obesity, diabetes, anything that if you do get COVID, you would actually be more likely to be hospitalized or at risk of dying. And then also those that have immunocompromised systems are also recommended not just to have a booster, but some are actually recommended to have a third dose. And I think Dr. Boykins was talking about this previously, so that there's a difference between the actual dosage for that of a booster versus the third dose. I know a lot of people are concerned because we have heard that you are able to do mixing and matching, as we're calling it, and it is perfectly safe. They found it to be safe and effective. They've actually also found, especially with the Johnson & Johnson, if you've had only the one shot, if it's been at least 6 months later, to get a second dose, and it can be of either Pfizer or Mrna, that you actually have even more immunity with that booster shot from the first previous shot for J&J. So it's not just recommended, but the studies have shown that you actually have an increased response to your immune system with that booster. So definitely recommend it. As a medical professional as well, we are also given the green light to get a booster. I've had my booster shot. And so I definitely recommend that if you are 65 years or older, immunocompromised, underlying condition that would cause you to either be hospitalized or at greater risk of dying, or in a profession where you have a lot of exposure or increased risk of exposure, to go out there and get your booster.
Outstanding. Dr. Nicolette, Dr. Ragland mentioned something about mixing and matching. What in the world? Mixing it. We talking about socks? We talking about shoes? What in the world? Mixing and match? Talk to us about
So
mixing and matching.
we normally never think about the brand of the medication that we're taking. I've never heard somebody say, hey, I want the Merck this, or I want the AstraZeneca that. But because of how we've communicated the development of these products along the way, there has been an interest in wanting one product versus the other. So now that we are at the point where we're talking about boosters, we're talking about additional doses, and getting to a point where we're really just trying to get the largest population we can fully immunized, there's still this preference. There's a brand preference we're seeing. Some folks are saying, I really don't want the J&J. Well, I know about them, from other things, baby powder and other products. So really mixing and matching comes down to, there are 3 vaccines that are available, and any of those vaccines are sufficient to give you immunity. If you go to your local pharmacy, there may be one vaccine that they are carrying. If you were immunized with your primary dose series and you had the Pfizer vaccine, yes, you can get the Mrna vaccine. If your first immunization was with J&J, you can get a Pfizer booster. We are talking about brands now because we've been watching the development of these products, but we don't have to get stuck on the particular brands. And as Dr. Boykin mentioned, there are a few nuances in there. So I will say with the Johnson & Johnson vaccine in particular, knowing that if you did receive the Johnson & Johnson vaccine 2 months after that primary dose series, you should be getting a booster. There is an advantage to getting a Mrna booster. There are trials that show that that booster does give a higher level of immunity, but we really don't have to get stuck on the brands here.
Very, very interesting. Very important. So don't get caught up on the brands. Now let's go ahead and stick with the ladies, because there's been some conversation. There's been some thoughts about these vaccines as it relates to fertility, as it impacts for the ladies. So we've got a lot of ladies that are watching. So Dr. Ragland, can you talk to us about what do we know about these vaccines as it affects or otherwise impacts a woman's body?
So we have studies have shown that it doesn't decrease fertility, if you will, that we've had no issues with that. What some people have been commenting on is it may affect the actual cycle, the menstrual cycle itself, having some irregularities, either slowing down, stopping, and then needing to regulate. That's not uncommon for several things that we have in our bodies that will either induce an immune response or some sort of response. But that's been the bulk of it. I will say that it's been highly recommended that women, especially women in pregnancy, get vaccinated, because it has been seen to give some immunity to the fetus as well, and also that they have better outcomes after pregnancy, after delivery, in terms of surviving through COVID. We've had cases of women who were unvaccinated, either refused to or just didn't get vaccinated in time, who did not survive after childbirth due to COVID. And something that Dr. Boykin mentioned earlier, this is not the time for parents to feign from being vaccinated, because we are the other pandemic as a pediatrician that I have to talk about is that we are experiencing orphanage from COVID viruses that are affecting especially our single parent homes, which is increased in our Black and Brown communities. So it's very important that as parents and as women, we see that we have higher numbers, but that we continue to be vigilant in being vaccinated.
Dr. Hardwick, how we doing? You got a microphone good now? We good to
I
go?
think we're doing just fine. I
Come
think
on.
we're doing just fine.
Excellent. Go ahead, chime on in there.
Well, I do agree in all of that. I am seeing more patients that are having issues in regards to the thought of bringing children into this world, their reproductive status. Most men, there was a small article, and I can give that to the bros at a different time, but that talked about the efficacy or the increase of the sperm count for the men. It was a small trial study that was done with New England. It was posted in the New England in the Journal of Medicine online that I was reading. So I don't think men even thought about that. They have been thinking of their loved ones in regard to losing them from the small portion of women who did have TTS. But at this point, we need to focus on modeling. I am saying modeling, 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 because at this point, I'm seeing my young people, 17 to 22-year-old, being hospitalized based on COVID and getting that medical exemption that Dr. Jedan talked about because of their fear, the myths in regards to COVID, as well as just not understanding the entire process that vaccines go through. So, in thinking in that regard, I'm thinking about, excuse me, I'm thinking about trying to model those behaviors because we have those people in transit, the young people who are without their parent, and then the older uh, young people or our teenagers and adolescents who are actually really in that moment where they're trying to make a decision, but they're looking at their parents' behavior and saying, why should I if they're not? And they're taking that into perspective with how they're growing and how they're managing their thoughts for their own future.
Outstanding, outstanding. It's not a party unless we have, all four horsemen. Certainly at this time, we want to welcome Brother Wonzie Gardner, one of the fellow horsemen here. Wonzie, certainly good evening to you, and certainly our Dr. Guyton, our pharmacist with over 25 years. We certainly want to say good evening and welcome to you all. Wonzie, why don't you go ahead and chime in? Where are we as far as federal response? What's the government doing now? There's been some mandates out there. Talk to us a little bit about what's
Yeah.
going on.
First, I want to apologize for being late coming on board because of those mandates and things. I was working kind of late. And to my sisters in the medical field, you're in tall company with my brothers. I'm not a doctor, so I'm the little kid on the bus in the back seat, okay? But what I'd like to do is talk about the federal response. As you all know, the federal government has mandated vaccines for all employees by the 22nd of November. We're still working through the logistics of that and how that's going to be played out. And one of the things that I'm really concerned about is the fact that although we are all for the vaccine, I think with the politicization of the vaccine, the rollout, and like one of the doctors talking about us even getting down to the name brand versus the medicine, we've so politicized this thing, it's gotten really hard. And one of the things I'm really struggling with right now, we're struggling with on the Chico Council, is how do we continue to educate people? How do we convince them that the vaccines are safe, they're secure, and it's a requirement now for federal service. Um, One of the things we're really struggling with now, and the federal government is kind of leading the way, is that if you're not vaccinated, we're looking at starting disciplinary actions up into including removal from your job. And that's one of the things as a black man, if I can speak freely here, I'm having a lot of trouble with because the data shows right now that a large majority of people that are not vaccinated are African American or brown people. Um, and I'm struggling with the fact that a person can work 25, 30 years in the federal government, and because we so politicize this thing that that they may lose their job. But on the other hand, we've got to try to find a way to make sure that all Americans are safe and secure. And this administration, if I can speak freely, has decided that mandates are the way to go. We've tried all kind of campaigns, and Brother Guy will talk about that a little bit more. But what we've done, and we're at a crossroads right now, and I think all the doctors will understand and can agree that if we don't do something drastic, this virus will mutate more and trying to stay in my lane. From what I do know as a layperson, as it mutates, it will impact other people, and those that are vaccinated could be at jeopardy, at risk also. So the federal government, as usual, is always trying to be the leader in this space, trying to make sure that Americans are safe, they're secure, and they have a bright future. Right now, because of the environment we're working in, it's hard for medical and scientific professionals to stand up and stand forth and do the things that they have been trained to do in a way that the American public will believe them. There's so much misinformation and disinformation right now that it's very hard to do that. So in the federal space, there's a two-pronged campaign. One, to continue to educate, and also, as I said earlier, the part about the enforcement of not being vaccinated and the possibility of losing a job. And so right now we're in the phase of trying to educate our federal workforce more. We're trying to look at the legalities of saying that if a person is not getting vaccinated, can it withstand the court pressures? We're trying to look also at the perception as well, because it is a perception issue, because we have a Democratic president, if I may say so, who's battling misinformation from the last administration. So we have left the realm of science and logic, but going to the realm of emotion and disinformation. And so with that, brother Mfofo, I'm still battling the need to make sure that everyone gets the right information. I feel Brother Guyton's pain every time he talks about that. And I'm still battling the need to make sure we're fair and that we're balanced in our decision making process, and advising the White House on and my seniors of the right next steps as we move forward in this domain. Thank you.
Outstanding as usual, Brother Gardner. Thank you so much. Dr. Guyton, your favorite topic. How do people put this information out there? Where do they get it from? And just remember, there you go. Where do they get it from? People are talking about this, stuff growing on your back. Come on, talk to us about it, Set everybody straight on all these crazy things that they're hearing. Talk to us about this misinformation and how we get them straight.
So first, again, thank you all for allowing me this platform again. It's been a long week, a long day, as we continue to try to educate, treat, and support our communities. We have some very good news on the horizon as we look at a number of these vaccines being okayed and verified for use in our kids. That does not stop us from the battle that we have against the disinformation and the misinformation that continues to grow. As you know, we were right here in July when we thought that we had conquered this virus, and we relaxed. What we cannot do now is relax. When I say relax, we cannot really relax as COVID ambassadors in our communities. Disinformation is the other arm of this pandemic that is destroying our communities. As Brother Gardner has said, it is our Black and brown people who are getting the majority of the majority of the ones that are not vaccinated, and that look like they're mostly impacted by the disinformation. As studies have shown, disinformation is accepted 70% faster than the truth. So what we've got to do, and what the ladies are doing, and what our community partners, our fraternities, our sororities, even now the our government groups, our government itself is forcing our hand. We need to continue to preach and push the legitimate sources of information. Disinformation has done more damage and misinformation to our community than this virus will ever do. I'm still working with my family in different areas of the country, and their statements are, "Oh, I won't get vaccinated until my child gets vaccinated." Well, I called you yesterday and you're saying, "Well, I just need to make sure it's safe for my child." I said, you keep moving the goalpost until you're going to be buried under the goalpost, because the next option for you is, and can be, death. If you don't want to protect yourself, protect your children. Please get your children vaccinated. This is the most widely studied vaccine in the history of this country. Do you understand and see what I'm saying? We have got enough data and enough proof, and I keep getting the same answer. I need more information. Information on what? You know what it does if you're not vaccinated. You know how it saves you if it's vaccinated. Please get our children vaccinated. And let me say one more thing. We have been warned, and we have been given the heads up that the flu epidemic this year will be the worst ever in this country. So when you're getting the COVID vaccine, you go, well, the flu wasn't a problem last year. Well, guess what? Everybody was home in front of the computer like I am. You got kids going to school. You got states mandating that they can't wear a mask. They shouldn't wear a mask. And I tell my kids all the time, I call them colonizers, because they always have strep and flu sometime during the year. It is time to step up, family. It is time to step up, parents. Get the flu vaccine. I got my third dose because I deal with the communities every day. And I'm asking you, if you won't do it for yourself, do it for your children. monitor what they're hearing, monitor what you're hearing. If it's not true, if you can't verify it, don't share it.
As usual, outstanding, Dr. Guyton. Thank you so much. Let's have a little bit of a trifecta here with the pediatricians. This vaccine now that for the ages of 5 and older, it sounds like just recently passed. Talk to us about parents that are now hearing that their 5-year-old could possibly be vaccinated. Now, obviously, kids take many vaccinations as it is right now. So, but I'm not a doctor. You guys are the doctor. So, talk to these parents that are now asking these questions about a vaccine, COVID-19 vaccine for my 5-year-old or my 6-year-old.
Okay, well, I can start. First of all, so you're right, it's 5 and or 6. So for the Pfizer vaccine, the emergency authorization use has been approved for 5 to 11. And for the Mrna vaccine, it's actually 6 to 11, right? So those are the differentiations of those two vaccines. As a pediatrician, however, you also know that our parents, this is not a new situation for parents. Children have been vaccinated. First day of life, you get your hepatitis B vaccine, as well as a vitamin K. So they're getting stuck and prodded. We take a newborn screen. So this is ancient. Oh, we've been doing this for years now. We have approximately 16 vaccines that our children actually receive between 0 and 18. And if anyone wants to have these conversations and the transparency about some of the conspiracy theories, for instance, about, say, some of the side effects of things like, that was thrown around about, for instance, autism, that was thrown out. The very person who did this very small skewed study was actually, he got his medical license was revoked because the information was false and it was inaccurate. So a lot of the things that we're dealing with are, we understand that people have some fears, and we understand that there might be some trepidation because they're young. One, the dose is smaller because it is the pediatric population. But we've already been testing children. The children in the study did very well. The vaccine was effective and the vaccine was safe. And so at this point, this is not new for children. I think that parents, what's great also, I think, to make sure we understand about this particular vaccine for kids is you can't just go to the pharmacy and get a vaccine for your kid. You actually have to go through a pediatric source. So it actually optimizes the opportunity to ask questions, to have conversations, and to actually have some guidance. If you have a particular question about your child, some underlying condition of your child, or whatever your questions may be, but it's a little bit more organized for the children's vaccine than it is actually for adults. So hopefully that gives everybody a little bit more confidence in the rollout for the vaccine for children.
Dr. Hardwick, chime in on that. I know you've got obviously some experience with the 12 to 17-year-olds, but please chime in on that subject there.
And I also think this is an opportunity for the parents to get themselves vaccinated. If you want to do it, if you want the child to play lacrosse or play basketball this season with his teammates, this is your opportunity to come right in, get it with them, and then go through the process with them. It's nothing like a parent doing something with their child. And this is most important because I'm telling you that child is going to school, he's going to games, he's doing everything, and he's hearing how some of these parents have left their children. There should never be an instance where a child should have to the child should always bury their parent. But if there's a way to prevent this, why not do it together? Why not walk that walk together so that you can be a support to those children who have lost their parent?
I just want to add to one of the things that we should be really aware of as well is that we've been talking about how from July to say September, there was a 240% increase, right, in the infection rate in children. And, you know, it's very interesting because I think that we kept assuming that children, you know, were immune to this somehow, that they weren't being affected. We didn't see them going into the hospital and dying until the Delta variant. But it's obvious now that it wasn't that the kids weren't infected. They just weren't being tested as much as they have been now that schools are open. Now that schools are open, and, you know, we're regularly testing children who are asymptomatic, who just happen to be in the classroom with their classmates. We're seeing higher and higher numbers, which means that our children have been probably infected a lot. Most of this time, they've just been asymptomatic. And now that they're in school, now that we're going inside, all viruses are going to increase. Sickness is going to increase. And one of the things that most of us know is we've seen not just the flu virus is going to be extremely bad, but we've seen that the RSV season this year was particularly bad, which isn't usual for this time of year. We have some RSV, but we actually had a lot of hospitalizations and a lot of death. So COVID, in the backdrop of COVID, all of these viruses are going to be unchecked. And so we have to be very diligent in getting this information out and getting vaccinated. But we're going to see even more numbers because we're testing regularly because kids are in school.
So all this information that we're all talking about, all of this getting vaccinated, there's another side that I think, and right now I want to, let's go up to New York. Dr. Phillips, Dr. Nicolette, represent. Listen, what happens to somebody, whether they're vaccinated or not vaccinated? It's now time for them to go to the hospital. What's happening, and as it relates to the healthcare system because of this pandemic? Dr. Phillips.
Well, again, you know, what you're seeing is that regular stuff, you don't have the resources available that you would have. So again, have that heart attack, have that basic pneumonia, have that back pain situation, or have that leg fracture. You're having individuals, number one, who are saying, I'm not going to go to the hospital because I'm afraid that I will get COVID. I don't think they're going to be able to take care of me. And then once you get there, you have a, you know, unfortunately, sometimes a mass unit, meaning most of your high functioning staff are directed towards your COVID stuff. And the people that would normally be involved with these other issues are not available. So these other issues don't get the quality of care that they would like. I think another thing that we've got to start thinking about is the insurance companies are not going to be sitting in the cut much longer, just allowing their resources to be dilapidated by paying for medical costs associated with the unvaccinated. I think there was a number out within the past month that said over the past 3 to 4 months, I believe, $6 to $7 billion were spent in the medical system for unvaccinated medical care involving COVID. And I do not think that they're going to continue to allow that to happen because it is starting to be noticed. So we are seeing in New York these things happen, but I got to share with Brooklyn. So Brooklyn, you go right ahead.
So all of that, I would add to that, we have something that's called crisis standards of care. So as somebody who works in the disaster space, it's not just COVID. So as Dr. Jedan said, it's COVID, it's the mass shooting, it's the hurricane, it's the tornado. All of those things are highly disruptive events. And while we have been talking about COVID for the last few months as a community, the reality is that COVID has been decimating healthcare systems for almost 2 years now. So what that means is our supply chains are strained and haven't had the opportunity to recover. What does that mean for most people? That means that that medicine that we would normally use or prefer to use may not be available because it may be stuck on a ship somewhere at a port waiting to get offloaded. What does that mean for the providers? That means that the providers have been in this highly stressed, highly traumatized world of delivering COVID care. But it also means that the systems are not built to withstand 2 years of strain. 6 weeks, 8 weeks, sure. 2 years is not feasible. And so there are systems that are built to be able to allow for us to apply structure to how we administer crisis standards, which means no, everyone is not going to be able to get the gold standard of care because it is simply not available in a system that has been strained for 2 years. But that also means that decisions have to be made about patients who have the ability to withstand care and survive. If you are a vaccinated patient and you are coming to seek care for COVID, your body has built-in immunity because you have made the decision to be fully vaccinated. That patient will be treated differently because they can be treated in that hospital with a high likelihood of survival. So those are realities that we have to contend with. And that is something that the federal government has been very clear about and has been working with the provider community to ensure that those crisis standards are rolled out.
That's powerful. I mean, the Braz, we say that's rec mode, but that's powerful right there. Um, let's continue with that topic, Dr. Phillips. So we're talking about the importance of vaccination. So there's people that have had COVID. Some people believe in, I mean, I know you guys believe, some people have had COVID twice. Yet they still say, oh, I don't need to get vaccinated. I had COVID. I'm good. Dr. Phillips, talk to us about that. Why does somebody need to get vaccinated if they've already had COVID and they're fine?
Well, the first thing I would say is that vaccinated immunity is stronger than immunity that you would gain from having COVID. In addition to that, immunity that you would gain from COVID, if you have a mild case of COVID, they speculate it's might be maybe 3 months that you might be immune. If you've had a more serious case, it could be 6 months. Unfortunately, what we started to see was individuals that caught it in the beginning and said, you know what, I got through it, I'm good, I got immunity. And then we go to 2021, which is more than 6 months from that early portion. And these individuals, unfortunately, tended to be some of our more serious patients. We know frat brothers that have passed. Again, I know one specifically had COVID twice, felt, man, I'm a strong man, I got this. Got it a second time. Unfortunately, as we said earlier, we've got 3 daughters that are part of that 250,000 children that are orphans now. So it is real. And again, for individuals that have been sick with COVID, if you've gotten monoclonal antibodies or if you've gotten remdesivir or any of those supportive medications, 90 days after you're better, you're a candidate for getting the vaccination. If you had mild COVID and you got better, 2 weeks after you're asymptomatic, you can go get your shot. So again, non-vaccinated, 11 times more likely to be hospitalized for COVID, 12 times more likely to die from COVID than vaccinated individuals. So again, unfortunately, all of the direction of where we don't want to go, lining that pathway is lack of vaccine.
Can we also talk about the fact that those who are vaccinated, not just do they get less sick and possibly not die, but they're less likely to be contagious, right? They have a lower viral load. So the other reason we want to talk about vaccines is that it is going to allow us as a society to move out of this and to move on. You're going to be less likely, those of us that are vaccinated are far less likely because our viral load is low, to pass the virus to others. That's another reason that when you go into the hospital, they're more likely to treat you because you're not this contagious vector that someone who is not vaccinated is, right? And so if you're protecting not just yourself, you're protecting those around you, you're protecting your children. As teachers, you're protecting the students. Coaches, you're protecting, your players. All around, this is not just about protecting yourself, but it's also about making yourself less contagious for others if and when you are introduced to the virus.
Dr. Nicolette, you was talking about the you said it so eloquently, but you was talking about basically those who choose not to get vaccinated and potential impacts on the. Go ahead, continue with that though, because I think we got some additional follow up there.
Sure. So I know there's some follow-up questions there. I don't know if you want to ask the follow-up question, Wonzie, and then I can jump in. Entirely up to you. You're on mute.
Today was very interesting. I work with a lot of smart people, not as smart as doctors, who are trying from a societal standpoint to try to pass and craft laws and or legislation to benefit society. And sometimes I'm afforded the opportunity to get in there with thought leaders who are trying to think about these questions you just posed earlier. And it came up today when you were talking about it, because it was like, if you have two people that are going to the hospital and one was vaccinated and the other chose not to, who should be the person that receives the care the first? And it goes back to what brother Jedan Phillips was talking about before about the insurance companies. That's where it all started from, our conversations today. And right now, you gave a perspective that was different than what our group said today. Is like, when you chose not to get vaccinated and you had every opportunity, you made a choice already. So why should the government, why should society expend resources? Because you made a choice. And it got very, very heated because you had liberals, you had you had everybody in the room, and it blew up. But Nicola, that was the first time I heard you say that because a person is vaccinated, they can withstand more. So I kind of can push you to the side. I'll treat this other person, which was counterintuitive to the conversation we had this morning, because this morning it was like, wait a minute, we've been giving this message all this time for 2 years now to people about getting vaccinated, and they don't see the light till they get sick.
Right.
And the question was, wait, is that fair to the rest of America, the rest of society, for us to expend those resources when people can't get various types of surgeries because the hospital beds are so full?
Right.
So I was very perplexed. And your comments today, I wish you would have been in that class today, because it was totally different than what we were talking about earlier. Because the consensus was, no, if you don't take the shot, then why should you go to the head of the line?
No, so to be clear, what I was defining was a situation where you would have two patients with COVID that are presenting, one being vaccinated and one being unvaccinated. And the unvaccinated patient would actually be the patient that would not be prioritized for care, understanding that the vaccinated patient would first and foremost actually show a higher chance of survival and be able to use hospital resources to the wisest outcome. And part of the reason that we have crisis standards of care and the reasons that HHS puts a lot of us in these rooms to battle it out in this way is because you actually want to make sure that there are systems in place to guide these decisions. These are not physician-specific decisions. These are not facility-specific decisions. And it's really important that they're not, because again, this is a highly stressed situation where not just the individuals are stressed, the systems are stressed. So the goal is to make sure that for that collective, that we're able to deliver the highest level, best possible, consistent care for the whole of community.
And that's why it's so important for people to understand, when people like you all get in the screens, it's not you speaking just what you believe, but a system about the process. It goes back to let the process work, and the process will lead you where you need to be. But in this situation, in this case, the process was usurped because of other reasons which we won't get into. And I wish to God that we could get back to the process where people like you all would lead the discussions, so that other people can be in the room, the ethicists and everything around there, to make those decisions so we can make the right ones for everybody. So thank you for allowing me to comment on that.
And if I could just jump in for 1 second, I think it's really important to know, as somebody who has been in this space for a while, none of the systems that are being used right now are new.
Yes.
And so I love the fact that there's a pharmacist on here, because we talk about the role of pharmacists in disasters all the time. Pharmacists administering vaccines is not a new phenomenon. We've been fighting for that, and pharmacists have shown up time and time again to stand in that gap. The systems that we use to develop the vaccines, all of these exist as frameworks that are not new at all. There are pandemic legislations that govern exactly how we are able to make sure that we are protecting detecting and responding. There are systems that are stood up to focus on how we do national health security frameworks and biodefense. They're not new. And there are people, nerds like me, that are in rooms every day making sure that we are advancing those, and now trying to advance those with a lens towards equity. So we're not creating and innovating on the fly. We're instituting the systems that have been in place, have been tested, and frankly, we will need at some time again in the near future should we have another pandemic.
Preach.
Thank you for standing up for pharmacists.
Anytime.
Hey, bro, DR, I wanna bring one thing, and the pediatricians can speak to this. We're dealing with the myth that, if your kids are vaccinated with COVID, they shouldn't come to school because they can shed and get everybody else infected. You should not have your kid coming to school. That is a complete lie. That is false. And we're dealing with that type of misinformation that starts attacking once we get over that mountain and say kids can get vaccinated. Here's the next lie that hits the internet. And it's being perpetuated in a city in Miami where my family is, that, they're saying don't get my kid vaccinated. If they get vaccinated, they can't come to some schools. So can you speak to that, some of our pediatricians, about that myth that's ongoing?
Sure, I'll take a step. I apologize, everyone. I lost my access due to technical difficulties. But first and foremost, we know that the vaccine does not contain any of the virus anyway. So that's the first part about it. The second part about it, if you come to school and you're sick, most likely you're not vaccinated, because you are that particular petri dish, whatever you want to call it. And we know, and I'm sure the other pediatricians online know, how many times we've had parents come in and want us to give them something to pad their child up to send them back to school ill. And that's how this whole thing gets started. They'd rather send their child to school sick and for whatever other reason, for something we can't be vaccinated for, rather than vaccinate the child and protect other children from it. Now let's think about the whole process of how this goes and why the importance of children in this whole situation. Because the younger children are not the one necessarily spreading it. It's the older ones that bring it into the younger ones, who take it home to the older ones and bring it back again. So it's a vicious circle. They may not have the same amount of transmissibility, but they have enough that they spread it to the elderly people at home. And so this myth about your child taking it to school is just not true, because they've got it from somewhere else, but they bring it to school if they're not vaccinated. And that's just the way I look at it.
I mean, and then to reiterate again, it's the vaccinated child and person who actually has the lower viral load if they get COVID, and they're less likely to spread COVID. That's the whole point of the vaccine's point, is to stay out of the hospital and not die. But the benefit is also that you're less transmissible. You'll have a lower viral load and you will actually transmit it less. So the concept that a child being vaccinated would go to school and spread anything is odd, because that means then we should be discussing them spreading polio and measles and mumps and rubella, all the things that we vaccinate children with, which actually have the protein. And as Dr. Boykin just said, this particular vaccine has none of the virus in it. It just had the messenger for the virus. So it's just illogical and just backwards thinking. And really, anybody with these questions should talk to medical professionals, to individuals who have gotten degrees in substantial places versus internet docs.
Thank you.
This is not a live virus like the chicken pox or the MMR, and even those live viruses are attenuated. So only someone that's immunocompromised at school could get infected from them. But this is not even a live virus. It's not even a virus. Not even a Trojan horse like the Johnson & Johnson. So these two vaccines, well, the one vaccine, the Pfizer, that's going to hopefully become available next week for widespread use, is the mRNA vaccine. So let me make it pretty clear to all the parents out there: it does not contain any virus, and your child will be getting a much lower dose, 1/3 of the adult dose, of when they are vaccinated against that. So you cannot spread COVID-19 by getting your child vaccinated. This vaccine is just as safe as any of the other vaccine. It has a safety profile probably more scrutinized than any other vaccine out there because of all of the misinformation out there and all the things. I mean, these vaccines went through a process where people saying they came to the market too shortly. But let's think about it this way. In a normal process virus, you have a serial way that a vaccine is introduced to the market. That's why it takes so long. Well, because we had the technology for many decades on how to produce this particular mRNA vaccine, and we didn't need the manufacturer to come up with the money because the government subsidized, we could do things in parallel. They can run together. So it appears that it came to the market very quickly, but it did not. And why is it taking the pediatric vaccine so long? Because that's the group that we have to protect the most, has the most safety profile out there. So I want to say to you, don't believe the misinformation out there about the vaccines for your children, and realize that your children may not be as sick as anybody else, but they can certainly infect you if you're unvaccinated, and your elderly grandparent or elderly person in your home, because they may have a mild case of it, but give it to that one person and they may end up in the ICU if they're not vaccinated and may not survive.
Let me put all the doctors on the spot. We gotta, because clearly it's either people understand they've gotten the vaccine, or they're just not going to do it, or there's some people that are in the middle. I think if we all agree, it's either I'm vaccinated, whatever I got to do, I got it. I'm not getting vaccinated. I don't care what you guys tell me. I'm not going to get vaccinated. Or somebody's on the fence. Somebody's like, so my question, what reason, and I'm not talking about a religious exemption, or even if somebody actually has a condition where, the vaccine may not be, what reason would a person have to not get vaccinated?
Well, I'll take a stab at that. They may have some other underlying medical condition where they may have a reaction to some of the components of the vaccine, or they may be so severely ill that they just cannot take the vaccine. Only their primary care person would know, provider would know exactly why they can or cannot take the vaccine. But I tell you, there are very, very few reasons why anybody cannot take the vaccine. One of the questions that came up again to me tonight was, my spouse or whomever is a kidney transplant person. And I know early on people were very worried about getting the vaccine and if you have an organ transplant. But that's one of the reasons why the FDA and the CDC approved the third dose of the vaccine in that particular, because they were so severely immunocompromised. And the safety profile data showed that it was very safe to use in this particular population. So, that would probably be the only reason I would say you really would not get the vaccine. Again, if you had a serious anaphylactic reaction to any type of injectable thing, that's probably one of the few reasons that the CDC outlines in their guidelines for not getting the vaccine. And if you want to know what they are, anybody, it doesn't have to be a physician, can go and read those particular reasons why you should or should not get vaccinated against any of the vaccines if you're worried about having a reaction to them. But the safety profile far outweighs the risk of them. And even the case of, I don't know if we talked about it earlier, but even the case of the young males and getting myocarditis. Well, that myocarditis is not the same as the myocarditis and the carditis that you get from having COVID. So, if I were a parent, and I am a parent, I would rather take the risk of my child having a possibility of having a rare myocarditis that is treatable than to get a serious myocarditis from COVID-19 disease and not have long-term effects from it. We know that, autopsy samples do show presence of viral particles in the cardiac muscle if you've been infected with COVID. And because you don't have COVID in the vaccine, you won't have it in your well, I'm not saying you won't have it, but you don't have the same chance of having affecting the tissues like you would if you have de novo COVID-19 disease.
But let me give you a different perspective there, Doc. And looking at clinical, and I put my epi hat on. Communication and competence. The communication component has impacted our community worse than any other community, meaning we get our information from multiple different sources that are not verified. We don't go to the trusted sources. We get the Facebook posts. We get that. And then you're looking at the competence. Some of our communities are not competent enough to understand what you just said about myocarditis. They're hearing Tuskegee and they stop. They're hearing, they're tracking me and they stop. So we have to increase the competence of our communities by educating them over and over. As an epi guy working on in many underserved communities, I always understood health education and communication eliminates and alleviates a lot of the levers that have prevented and increased the barriers. I advocate, if we're going to study social determinants of health and looking at how COVID has impacted our communities, let's start with communication and competence.
I think that's so important, 91, because again, look at who's dying. We 1 in 480 of the deaths are 1 in every 480 Black people are dying from COVID. Latino brothers and sisters. In addition to that, we're still trailing in every demographic from as African Americans as far as vaccination. 12% vaccinated was the number that was said earlier. We all here know 12% ain't going to get us out of this pandemic. And again, to your point, Dr. Guyton, you know, we have to be, that's why we're sitting here right now, being in the middle of this conversation, because unfortunately, people are so ready to move the goalposts to suit what they're comfortable with. Even though you may have gone to school for all these years and have this expertise, they still say, well, I'm going to wait and see. And as you said earlier, I think that's going to be my new line. Wait and see for what?
But I think there's a point to be made about why we're talking about getting vaccinated all of these months later and being patient with people who may still be hesitant. What I do not want to say is that I cannot understand why someone would be hesitant. You know, Dr. Kathy and Dr. Jedan and I were talking about the fact that we were some of the first that got the vaccine, and we had, you know, a moment, but there is also, in addition to our own questions about it and the uncertainty of this time, there is a very credible and real history of medical mistrust that is rooted in far more than the COVID-19 pandemic. And so as we're talking through this, it is important for us to be honest about Tuskegee. It's important for us to be honest about what we've learned from Tuskegee, what is now not allowable in the law, how the CDC and the FDA play a role in clinical trials and the protection of human subjects, and how we go about developing medical products that would make Tuskegee a federal crime today. And I think we have to be honest about those things and not just say, trust us, we're doctors, trust us, we know science. I'm not actually interested in anybody getting vaccinated because they trust me. I want to be able to explain it and be honest about how we've developed, how we've actually gone through this process, how medical development and science development and pandemic response have evolved, and how we're focused now on doing this in a way that we've never done before, which is centering protecting the most vulnerable, which are often our people in our communities.
If I can, let me do this, because we unfortunately, this is always happens every month. We're getting close to that time. Let me this one question we got. What is being done regarding new variants of COVID-19? Does the number of unvaccinated individuals allow the variant to mutate to something worse than the previous variants?
Yeah, I was answering that question in the chat.
Oh, okay.
And let's look at it. When I first came on, I talked about, let's look at Delta. I mean, you hear some of the news media talk about Delta is exiting, but that's not entirely true. Delta is 99.5% overall from where it was about maybe at the beginning of the month. But the flip side to that is 0.4% of other, which is rising from where we were at the beginning of the month. So what the government is doing, each time there is a COVID-19 positive test, they study the genomics of it. And while the Alpha, which is the UK variant, is not widely circulated in our country, but still circulating in other countries, it still is a vaccine being monitored, or a VBAB, vaccine variant being actively monitored. And we talk about variants of concern, variants of interest, and variants of high consequences. And unfortunately, here in the United States, we don't have any variants of high consequences, but we do have variants of concern, which is the Delta variant. and the previous ones are being actively monitored because they could come back up to harm us again. But the good news is, as we always said, even though the variants are out there, we do have some good protection from the vaccines that we have out there from those. It might not be 100%, might not be 92%, but in my book, any percent is better than 0% protection.
Outstanding. As we get ready to get closer to get to the end, unfortunately, but don't worry, we'll be back. At this time, we're going to have our closing comments, your last words that you'd like to share with our audience on this evening. We're going to start off with Dr. Kathy Hardwick.
I think that my last comment would be, if we can get change agents, it's enough with the 4 horsemen and all of my sisters being on the line, but I need to reach out to some young people, some teenagers, some college students. I need those to kind of infect their community with the education, with the positivity, and to be able to speak to all the myths so that we can come together as a people of color, so that we can raise these numbers, so that we don't have to deal with so many hospitalized or gone and homeless children, because that's essentially where we're going at this point.
Dr. Yolanda.
I would just piggyback on that. I think that so much has been said here. First of all, I'd like to commend you all for doing this work and for consistently doing this work throughout this pandemic and however long it's going to take. One of the things that Dr. Lewis Saint said that's very important is that, we want people, patients, family members, community members to be vaccinated, not because we said so, right? We want them to be vaccinated because it makes sense, because they understand, they've been educated, and now they understand what they're maybe, why it's safe for them, why it's the responsible thing to do. And part of the problem is racial concordance says that people who look like us are more likely to listen to us and actually feel comfortable to ask us these questions. But the problem is our numbers are so small, right? So, I call myself a unicorn all the time. In terms of the population of physicians, only 2% are African-American women. So we're such a small number. For men, it's only 5%. So we're such a small number that we can't depend on everyone getting to us. So as Dr. Hardwick said, we need to figure out how to educate enough people that they're comfortable. But part of the problem is we're now expecting podiatrists to be able to speak to this, dermatologists to be able to speak to this, orthopedics. People are asking, just because you're a Black doctor, whether you should get vaccinated, and we're not all well versed in vaccines, right? I feel comfortable being a pediatrician, family doctors, so most of us have been doing this. But we have to figure out how to help spread this information, not just amongst the medical professionals, but as Dr. Hardwick said, get some other folks that we can educate enough that are trustworthy enough so we can get enough of this information out, because they have to really feel comfortable and educated, not bullied into understanding what we're doing and why we're doing it, so they can feel that maybe they are the responsibility that's there. I think they would be more receptive.
Outstanding. Thank you so much. And we could have another topic on just doctors that look like us but don't agree with us. But anyway, we gotta save some. We gotta save some for next time. Dr. Nicolette.
So I just want to say thank you for having me. Thank you for maintaining this platform. I think it's so important that we are continuing to push out the message. So thank you for everything that you are doing. To be a little contentious, I will say everything that my sister said is so important. But I also think that we are talking from the vantage point of wanting to see people survive. This is about being able to survive this pandemic, live through this pandemic. And the reality is this may not be the last time we're having a conversation like this, we're responding to a disaster like this. A pandemic could happen again in the near future within our lifetimes. And so being able to survive this one and figuring out how we do that as a community helps us to be prepared for the next things that will inevitably happen as well. So I think everything that we're doing here and learning here helps us actually not just for today, but also for tomorrow. Thank you.
Outstanding. Thank you so much. Ladies, thank you so much for joining us. Our four horsemen. And for the brothers, they know our magazine in the 2nd District is called The Omegan. And these four outstanding, phenomenal brothers were featured on the cover. We are so elated to have these distinguished brothers. They've been with us since day one, starting through the chapter, working their way up through the district, and now for the entire fraternity. We call them our four horsemen, and they've been here since day one, and they continue to be here. And so I just want to say in front of everyone to the four horsemen, thank you all. The time that you take from your families, the time that you take from your occupation, the time that you take even as a retiree to make sure that every week we have updated information and that we're kept updated. It's just simply outstanding, and we thank you for it. So with that, let's start with 78, Dr. Boykin.
Okay, thank you. I just want to, first of all, thank the ladies for being with us again tonight. And I want to say to everybody out there, you know, it's always been our focus on getting our communities of color protected. And vaccination is certainly a tool that we have for us. But I'll say to you, take this information that you hear tonight and take it back to your communities, because we can't be in every place at one time. The good news is that there are some young people out there starting to spread this information. We have a SGA president at Delaware State that was a anti-vaxxer, but he got vaccinated, and now he's spreading the word to his fellow students at the University of Delaware. So that's one place to start. We have COVID-19 Community Corps out there. These are people that are not physicians necessarily, but ministers, teachers, whatever, that are taking their time to spread the information in their communities. So if we can have more people join that, particularly a lot more young people, we do have some young people out there in these communities already doing outstanding work. So we just need to get them more focused. Probably something we should think about bringing on this particular format. But I say to you, if you don't want to get vaccinated, that's your choice. If you want to get vaccinated, that's great. But whatever you do, please realize that this is a medical pandemic. It is not a social issue, or I'm sorry, it's not a political issue. It is protection for the survival of our very young, vulnerable group, our children. So please consider doing what you need to do to protect them, whether it's vaccination, vaccinating yourself, or mitigating, setting up a situation where everybody's going to be safe. Because we know that not everybody's going to get vaccinated. There's never been our intention that 100% of people get vaccinated, because we know they're not. But for the ones that will, great. For the ones that want to talk about it, talk to your primary care. Stay off social media. Stay off Dr. Google. Get information that's vetted. Please, please do it for the community and for the sake of getting back to some sense of normalcy. Thank you.
Thank you, Dr. Boykin. 88, Dr. Phillips.
All right. Well, first, I'd like to just thank our guests tonight. They have, as they did last month, brought the fire and the expertise that is so critical at this juncture. Again, as was stated earlier, we need to continue to get in this conversation because, unfortunately, we are seeing the direct and indirect effects of COVID that are happening. And the only way, because of the historical impact that we've had, or the historical experience that we've had as African Americans and people of color in America, the hesitancy and reluctance is understandable. However, big brother and big sister COVID don't care. So we need to understand that and need to make the best decision in light of that fact. The other thing is these mandates are becoming more and more of a roadblock as far as your ability to move around in the society. So again, you want to find out the right information about vaccines. I personally have been fully vaccinated, and that's another thing. the definition of fully vaccinated, if you are a person that falls into the category of requiring a booster, if you haven't gotten that booster, then you're not fully vaccinated. So we need to be mindful of these newer pieces of information as we go into, again, this dangerous season. As I've said over the past year, we have unfortunately trailed the areas outside of the United States as far as how they have dealt with COVID. And I really, truly hope that what's happening in the UK, where they're about to possibly lock down again, is not going to happen here. And as it was said earlier, it's not just about you being vaccinated. It's about how do we protect our weakest and most vulnerable. And if it is not just with information, let it be the right information. If you're going to get information, maybe it's the right time to go see your doctor. And when you go ask those questions about COVID, maybe you want to ask them, is it a good time for me to get my flu shot as well, which I've already received. So again, don't wait, because if you sit back and wait, I'm watching people get walked out the building. I'm watching kids lose scholarships. I'm watching other people not able to do the things that they would like to do. And unfortunately, you can't Karen or Kevin your way out of the situation or moment because they're not having it. You know, again, I'll bring it back and leave it here with New York because, again, I'm not a Brooklyn Nets fan, but they don't look as good without Kyrie. And I know everybody wish that he could play. So, again, y'all, we don't want to get to where we were last year, which was in the middle of January, 4,000 people dying a day. We are not at a good level right now with 1,100 people dying a day. So we have to exercise that restraint. Be vigilant as we go into Halloween, as we go into Thanksgiving, as we go into these gatherings, because again, everybody needs to go to the CDC website if you're traveling or hosting for Thanksgiving and find out what is the safest way that you can do it. Because unfortunately, I know a couple people at this Thanksgiving will be the 1-year anniversary for them losing someone they love. And let's not repeat that same phenomena again. So with that, I yield my time. Thank you very much.
Thank you, 88. Brother Wonzie.
First of all, to my sisters, thank you so much for providing not only wisdom but elegance at this hour to all of us. One of the things that I really want to say right now is I wish there was a way that we could make taking vaccines cool. We've tried to deal with the minds of men and women that look like us, but we are a society that deals with emotions and through emotions and different things. And I'm just reminded of how when I grew up in the neighborhood in South Georgia, how I wanted to be liked and accepted by people and my friends. And I did things to make sure I was in the in crowd. And the questions I was asking earlier after our thought piece this morning was to this group is how do we change the paradigm or change the perspective of this? We talk about educate, 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 and I agree with that. But how do we make for our community taking a vaccine cool? How do we make that something that I'm doing because I'm going to take care of my boo, my brother, my friend, my mom, my dad? How do we make it cool where people are actively engaged and saying, I'm doing this not only for me, but for my family? You know, when we look at growing up, I think everybody was smoking cool cigarettes. They wanted cool cigarettes because their friends smoked cool cigarettes. They drank a certain drink because my friends drank a certain drink. They bought a certain shoe because my friends bought a certain shoe. How do we make taking a vaccine that way where I'm doing it because my friends, my boys, my girl, my mom did it? And I think for our community, that's the missing link. You know, you guys have been on this battlefield for 2 years saying this message. It's getting through, but how do we take it that last tactical mile and make this something where it's cool in my community, where you go to Big Mama's table and everybody looks at you crazy because you didn't get vaccinated? How do we make it where being unvaccinated is looked at as being abnormal? Like let me clean up. Negro, please. How do you make it where we are not on the side of trying to get people vaccinated, but if you're not vaccinated, you're now the nerd in the room? How do we make it where not being vaccinated is so uncool that how dare you come out the house not being vaccinated, or you going forward? And I think when we start dealing with us from our perspective, we've got to do that, because the people that we're talking to on this webcast, they're vaccinated. So how do we get to those that aren't going to take the time to listen to us on every Wednesday night or at the end of the month? How do we make it where they go down to, man, did you hear what those guys said last night? Bro, you got your shot? Damn, dog, when you going to get it? You know, when do we get to the granular level where Ray tells Nook, man, you better go get your shot? I mean, that's what we're talking about. We're not talking about reaching people that use those kind of medias. We're talking about going into the inner sanctuaries of our communities. Brother Guyton and we're from Lower Georgia. He's 60 miles from my hometown, Albany, Georgia, where the epicenter was. And I go home and I sit there after losing mom, dad, my daughter. I sit there and watch people not have masks on when this thing hits. And so I ask myself the question, what is it that we're not doing, not as a society, but as a community, a Black community, to reach our people, to let them know? Because we've been up against the wall a lot in so many things, but for some reason, on this issue, it seems like we can't get our voice, we can't get our footing, we can't get our message to whether you are a scientist, whether you are a banker, whether you are a janitor, whether you're a police officer, whether you're a bus driver. We're all saying, I'm doing this because I'm Black and I'm proud and I'm going to do this for my people. And so when I ask the questions, how do we change the paradigm where getting the shot is cool? And ladies and my brothers, I thank you all for letting me get on the bus with you guys. I'm in the back seat. I'm not in the front seat with you guys, but I appreciate what you guys do. And I applaud your efforts, and I thank you for allowing me to be a part of this small journey with you guys. Thank you very much, Brother Amfofo.
Dr. Guyton.
Again, 91 bringing up the tail end, and I'm at the back of the bus because I'm the youngest, bro. And I appreciate, again, our colleagues for being here and supporting the effort of the 2nd District of Omega Psi Phi. I will say, Brother Wonzie, I was in Albany, and I spent some time there recently. And the first 5 brothers I met, 3 of them had just gotten over COVID. And the first thing they thought is, I don't need to be vaccinated because I just got over it. I got 90 days. And the thing that came to my mind is, let's have a talk. It's 5 of us here. Let's sit outside and let me educate you on one thing, the misinformation you're getting. And I'll start there. We must confront the misinformation every time. We must communicate and develop a competency model. I say that here with us, but we must communicate and provide adequate competency model, meaning giving correct websites, giving correct information. And when I say confront misinformation, it's communicate and meeting our brothers and sisters where they are. If it's re-educating them on the fact that you have 90 days worth of immunity, but you still can be reinfected and you need to get the vaccine. You got a young 12-year-old daughter, but you're talking about going to the Alabama-Auburn game, but you don't want to get vaccinated.
Yeah.
You're talking to me about, oh, bro, I'm here at homecoming, but I'm good because I just got over it. What I am saying to you is confronting the misinformation. The Surgeon General put out a great document. It provides us with a roadmap. Whoever you are, you don't have to be a doctor. You don't have to be a government official. Go to that website, USSurgeonGeneral.gov. Look at the things that he's put out for you. Church members. Meet your church members where they are. Active listening, understanding. Don't push it. Don't advocate. Just listen. And then you take the time to increase their ability to understand by giving them the right information and educating them, giving them the right sources. When we talk about competency, I think about common sense. And when I equate competency for us, is sitting down at the table talking to my uncle, who was the only one out of 12 people who wasn't vaccinated. And his son is calling him crazy, won't talk to him, won't go near him. And his son's 40 years old and was paralyzed when he had it. So it takes life lessons. We have to meet them where they are to communicate. And we have to give our our loved ones, our church members, our fraternities. We can do it. That's how you change it, Wonzie, is we give them the tools and repetitively we repeat the same message over and over. If you're going to live, get vaccinated. The alternative is a much worse. It's death. And I'll leave it right there, brother Popo.
Thank you so much. Once again, as you've all heard, to our esteemed panelists of doctors, we just say thank you. Brother Wonzie, we know you always remind us you're not the doctor, but you certainly, assist with the four horsemen, and we're thankful to you for your words and all of you. So with that, we'd like to bid everyone farewell. Again, thank you so much for joining us. October, breast cancer awareness. So certainly we continue to make sure we participate, we assist with breast cancer awareness. The month of November, we want to salute all of our veterans. Happy Veterans Day to all. Happy Thanksgiving. And we will see you all next month on the last Wednesday. Same place, same channel. Thank you so much. Stay well.